So you all can see my screen okay?
Yes.
Okay. Let me see if oh, there I go. All right, so welcome. Let's talk a little bit about chronic care management. Disclaimer, I will share with you what has worked for me. I'm going to share my personal experiences and not official legal billing or professional advice, but I will share with you what has worked for me. Always check with your state laws and or your governing body, whether that is the Board of Nursing and or the medical board. So if you got any questions about what I'm talking about tonight, my resource is cms.gov. That's where I get my information. Their site is updated often. So let's talk about it. So a lot of people have heard of chronic care management, but I'm going to do it as a frequently asked questions session. So what is chronic care management? It is a Medicare program where the government will pay us for at least 20 minutes of non-face-to-face time with the patient. That does not always have to be over the telephone. It's time that we spend anyway doing what we do. Phone calls, prescriptions, referrals, light bills. I just got a phone call, 8:45 p.m., somebody needing something. So it's everything that we are already doing, but the government is willing to pay us to do it. Chronic care management is strictly virtual. I'm not going into anybody's home for chronic care management. It does not even have to be video. It could be telephone, email, snail mail, and they even have studies out already about the great response with text messages with chronic care management. This is strictly virtual and a work from home opportunity. So who can bill for chronic care management? A physician or a qualified non-physician practitioner, which is a nurse practitioner, physician assistant, clinical nurse specialist, and certified nurse midwife. And if you're not either one of those, you can get your foot in the door as a rural health clinic or an FQHC. So who can do CCM? Anybody. If you know you do not have the medical knowledge to do it, you can hire someone to do, or hire a whole staff to do chronic care management. Nurses, I'm thinking about people who have access to patients, medical assistants, those secretaries, medical clerks, counselors, RNs, LP. If you got access to patients, you should be doing pharmacists. Look, but pharmacists already do medication education. They can get paid for doing this. Lab people, you going into those homes, if you're mobile, if you are at a designated space, you're talking to patients all the time. You're going to say, hey, you ought to be a part of my program. Social workers, case managers. Anybody can do. Insurance agents, they talk to patients all the time, whether it's life insurance or for medical insurance. So what are chronic conditions? Usually chronic conditions is 6 months. But for chronic care management, you need to have it for at least 12 months. So it's all the things that we see all the time: heart disease, cancer, COPD, stroke, dementia, diabetes, chronic kidney disease. These patients are not always old. Anybody with Medicare and that's disabled. You got 18-year-olds disabled. You have 30-year-olds, plenty are disabled. Autism is one of those chronic conditions. You have kids that are disabled. So, back up. So what do you do when you're doing chronic care management? It's simple. You're talking to the patient, say, hey, join my program. You're getting their verbal or written consent. You're going to agree to either you reach out to the patient once a month or they reach out to you. You're going to update that care plan, and you're going to provide a copy to the patient and to their primary care provider. So how do you start it? So you do need an initiating visit. Annual wellness visit is the way to go. Tell you why. Because this RN or LPN can do it. Evaluation and management, that's like a routine office visit for a nurse practitioner or MD. Think about how the laws you have with evaluation and management. With clinical oversight, where the physician has to be in the building, all that stuff with nurse practitioners. But with the annual, either one is fine. I like doing the regular visit, of course, because it's less documentation. But if you don't have, that's an asset. If you're RN or LPN, that's your plus. That's how you should market yourself. How you're able to complete that annual wellness visit for a provider. Out of that, that's a plus. So, who pays us? We take this question for granted, but people that really are not doing it would not understand. So Medicare pays us, and we get paid by Medicare. My slides are going backwards. So how much can you get paid? We see an average of $60 per patient per month. I've seen 60, I've seen 70, 80, 100, 120. I found recently somebody in another state says it's only 40. So that's why I said average. It depends on the region, depends on the payer, and depends on their plan. So what are the codes? This is a question. So I'm not hiding the codes. The codes are public. You can actually you can Google the codes. So here are the codes for it. And so when I talk about this to LPNs or RNs, they say, oh, but I won't get paid. Well, you will get paid as a nurse practitioner, but actually you can. So to an extent, I've noticed on this chart, almost they're paying clinical staff more than they paying the physician or nurse practitioner. You know why? Because physician and nurse practitioner should not be doing this when it can be done by somebody else. Why are you doing it? That means it's a more complex patient. Other than that, you can train somebody to do chronic care management. So how do you get on board with Medicare? It's called credentialing, which means paperwork. And that's why I post, submit it, try it. All they're going to do is tell you what's wrong. And as far as I know, you do not have to pay to get credentialed with Medicare if you do it the right way. Labs do, but not providers. So this is a question. I'm already credentialed with my job. Do I have to credential myself? The answer is yes. Because guess what? If you leave it your numbers like they are, you submit your billing, your money is going to go to that company. If you credential yourself and your company, they know where to send the check. Because I tried it with, I'm credentialed with Medicaid, with my job. So I asked the question, and they said, no. I have to actually do it from scratch. Look at my business. That's how I know. So how do you bill? I have clients that are billing. They kept putting it off. I said, just do it. Because like I said, they're going to let you know what's wrong with your billing. Then you correct it and resubmit, and boom. So guess what? When you get paid, you do it just like you did before. It finally worked. Do it again and over again. So what else can you bill for? There's so much more out there. Remote patient monitoring is a whole another deal. You can get paid for it in addition to chronic care management, chronic pain management. I don't even have diabetes education. That's a whole nother program, which I'm slipping on. That's my specialty, diabetes, that we can be billing for separate. Transitional care management and behavioral health for my, as a matter of fact, this is your scope of practice. We can do behavioral health intervention. So what else can you bill for? We talked about this a while back. You can get paid for asking those questions, that PHQ-9, for asking, have you been sad or depressed in the last 2 weeks? You can get paid for that. Asking about, a living will, you can get paid. Alcohol screening on everybody at least once a year. Cognitive assessment. Smoking cessation, of course, that might be every 6 months, but at least once a year. So what is a care plan? Now, this is actually stuff that we did learn in school. It's about having a problem list. You go based on a diagnosis. What are your goals? Let's go way back to nursing 101. What are you going to do about it? What are those social determinants of health? Who do you have to help you? That's a major issue. What is your environment like? Where do you live? Risk assessment. That's what's part of a care plan. So what software equipment is needed? A computer and a telephone. Software is not needed when you're starting out. You do need an electronic medical record. That is required for chronic care management. And there are apps available too for your phone calls that are HIPAA compliant and electronic health records. Do you need a medical director? Not necessarily. Now, if you go out to the community, find the office or a practice, maybe one of you have a practice, and it's your patient, so you would not need a medical provider. You will give the care plan. So how do you get patients? They are all around you, or like I said, from a provider that you may contract with. I'm at stoplight looking at people like, oh, they need chronic care management. They need me. Family or family or family. Where did I go today? Oh, I went to a 50th anniversary this weekend. I need to post that. But yeah, I'm like, oh my goodness, this is a room full of chronic care management. Because they've been married 50 years. Oh my, I had a good time. So why do I need to start now? It's the end of the year. Their insurance is going to change too. And first come, first serve. It starts with in January. So just say somebody's on, I hate to say it that way, but I think you would supersede them if you beat somebody to it in January, even though they've been doing it. But it's enough for everybody, so we're not worried about that. The public health emergency ends for telehealth is, for now, December 24. They keep extending it. But guess what? That has nothing to do with chronic care management. I didn't say it, but chronic care management came out in 2015. That's way before COVID. So chronic care management is virtual, period. That has nothing to do with the public health emergency. Some good information. Do I need to be the primary care provider? No. So let's look at this. Oh, let me give it a minute, probably. Oh, I forgot to post my picture. Can y'all add that picture to that slide that I posted earlier? See if y'all can add that picture to that slide. Thank you. So how much does our program cost? It's either a one-time payment of $1,250 or 3 payments of $500 each. We do the Rooter to the Tutor, Business 101, city license, county license, state registration, EIN, NPI for you, your business, if you with contracts or medical director, helping you. You don't want to be responsible, but helping you with your credentialing, marketing, that's logo, website, referral form, like I said, contracts, if you decide to do a contract with the office. We teach you billing and coding. Nothing like it. Nothing wrong with hiring somebody, but nothing like doing it on your own. We give you the care plans, which my nurse practitioners, you know what to do for hypertension. You know what to do for diabetes. And we give you a virtual assistant to get you started. Our program, I would say we aim for 12 weeks because, credentialing may take 2 months if you're doing good. And then it may take time for the medical director. If you have all of that, my nurse practitioners, you can start tomorrow. That's what I did. I heard about it. I found a patient the next day, and I billed for it, and it paid. So our program is different. We are with you until you are paid, and even after. We got clients that submitting claims and are getting paid. So you can get started today, or maybe tomorrow, 9 o'clock. We are having a 1-day, 2-day boot camp coming in January, maybe close to the end of the month, and most likely it'll be a Saturday, all day Saturday and a Sunday night, but you'll get it all in one day. You will get the whole program from the rooter to the tutor in one day. Oh, you all know me. Oh, I love that. So, yeah, I'm teaching my nurse practitioner students. My love, like I said, is primary care, adult, geriatrics, and diabetes. If you do not have your own practice or whatever, go ahead and get it started. Like I said, my clinic was established in 2014, but I had a full-time job. So when my job ended in 21, I didn't miss a beat. So, you know how to reach us, get on the winning team. And we do this every Wednesday. Any questions? Did y'all find that picture I posted earlier? So I can show it. With the Humana patient. Well, I'm going to just tell you about it. Yeah, so. Oh, wait a minute. I can add it on my phone. Let's see. That's what I was doing before y'all stop me. I wanna add a picture to the slide. That's why I got virtual assistants that help me. Oh Lord, how can I add a picture to the slide? Because that was a submit. Well, it's the word in that letter U that let me know it was chronic care management. See, it's fancy Canva. How can I add a picture? Copy templates. Camera roll. I got it. I got it. And what now? Did it do it? Reset. Images. Okay, there you go. Add to page. Y'all too slow. Y'all didn't get it before I did.
Hi, Doc.
It's
Uh-huh.
it's in the last page.
What? Yeah,
It's in the
right.
last page.
Which last page? Like what I just went over. Let's see. Nope. Talking about number 61.
61.
61. Let's see. Okay, I'm gonna try it from here. Okay. Give me a minute. Let's see. 32. That'll work. Mm-mm-mm. Uh-oh. Which way is it? What did the slide say? Oh, do you need a medical? Do you have to be a primary care doctor? So where is that slide? Which slide is the one? Do you need a primary care doctor? Okay, I'm almost there. I'm right here. So, first of all, like I said, I received a letter. So note, if you got my name, they know I'm a nurse practitioner. Yet you say physician. Dear physician, it says as your patient, primary care physician, we want to let you know that we have been unable to contact your patient, blah, blah, blah. A Humana care management team has a care plan for your patient. They didn't ask for my permission. They let me know. And they said if you want to add anything, they did not say if you do not want us to do this, let us know. They didn't even say that. But it said if I wanted to add anything, that's chronic care management. They didn't need my permission. Guess what? I teach chronic care management. You got one of my patients doing chronic care management? That's fine. She needs it. So something else significant in this letter. This is Humana writing me. Guess what, you guys? I'm not on Humana's channel. I'm gonna tell you what. This is the same lady I talk about all the time who insists on seeing me. So she obviously insisted on them putting my name as her primary care provider. That's why I say get your patients to call the insurance company and ask or demand for you to be. I'm not even take Humana. They got this addressed to me. They got so confused. She didn't probably worried them so much. They left position on them. She probably worried the mess out of them. Yeah. Chronic care management. And they tell you where to go to find her information. But I like this kind of stuff because that's how I learn more stuff. I looked up their care plans. It's all there. And I love the care plans that say, talk to your primary care provider or share this with your primary care provider. You're not trying to be their primary care provider. You're just a resource. So that was good. I like when I get letters like this. I learn from it. Yep. See the word them folks? They call me physician. Yep. So that was a good lesson. So do you all have any questions? No questions? Okay, so I checked out the dates. Seems like we're good for December with the holidays. And no good football on, so we good for December.